And my name's Sarah Briggs. It's nice to see you all. I'm going to talk a bit today about public views around sustainable healthcare and how does personalisation and prevention fit into that. So to give you a brief overview of what I'm going to talk about, I'm going to speak a bit about the background to healthcare and climate change and where approaches to personalisation and prevention fit into that, and then perspectives from UK focus groups that we ran last year. So when we think about health and climate change, this picture from the WHO illustrates nicely that climate change, so that's global heating, has a number of risks to human health, and these are related to climate-based hazards. So that's things like extreme weather events, extreme heat episodes, increasing air pollution, water scarcity, and so on, which you can see in the middle there. Is this going to work? There we go. And then individuals, so we were thinking about sort of from a personalised perspective, everybody's vulnerable to a different degree to these climate hazards based on a range of different personal factors, things like your demographics, where you live geographically, biological factors such as your age, your health status, socio-political environments, economic status, and so on. And when we think about healthcare, there are lots of different aspects to health, human health, that can be exposed to climate risks. So that includes the patients and people and communities, the health workforce, our health infrastructure, but also wider determinants of health like food supply. And these all lead to potentially adverse health outcomes. So that's things like worsening respiratory illness, changes to vector-borne diseases, malnutrition, and so on. The health system itself can do lots of things to make itself more resilient to these changes, and is also over here impacted by the effects of climate change. But we also know that health systems produce carbon emissions and have an adverse effect on the environment, and that feeds back into contributing to the problem. And that's really the reason that healthcare systems need to think about doing something about it. And we know that these changes are happening now. So on the left there, those pictures are taken 2 weeks ago from The Guardian. So those are the California wildfires, and you can see in the picture here, that's a medical centre on fire. And from my point of view as an oncologist, we already have evidence that actually exposure to things like wildfire smoke are associated with poorer health outcomes. So we know that there's a lower overall survival for patients after lung cancer surgery who are exposed to wildfires. And it's also affecting the UK. So this is 2 years ago when we had a very hot summer, and Guys and Tommies lost all their digital infrastructure because their data centres overheated, with obvious significant impacts on healthcare. And so there's a lot of work gone on so far to look at what the carbon footprint is of the NHS and think about what we should be doing about it. You don't need to look at this in detail, but you can see that there are aspects of infrastructure, but also aspects of patient care, staff and visitor and patient travel, and then a lot of the supply chain contributing to emissions with healthcare. And overall, the NHS accounts for between 4 and 5% of total UK emissions. And when we think about just the public sector, it represents 40% of public sector emissions. Within England, the NHS has really been at the forefront of some of the advances in making healthcare more sustainable, and is now legally bound through the Health and Care Act of 2022 to do something about this. This NHS England and bodies within it must attend to the requirements in the Climate Change Act. And we have a body called Greener NHS within the NHS that produced this Delivering a Net Zero NHS report, and has been really leading the way on some of this. The NHS is obviously devolved, so England, Scotland, Wales and Northern Ireland also have their own separate health policies, all with quite ambitious targets. And where does personalisation fit into this? Well, this idea that we're getting the right person, the right intervention at the right time is really sort of a key component of sustainability, in that we potentially therefore have better prevention. So we're really stopping people needing to access healthcare, and that potentially avoids also overtreatment can lead to more streamlined care and reduces harm to patients. It might help to facilitate more personalised care by providing more information. So there's a body of work talking about green consent now that suggests that actually if patients are interested, they should have information about the environmental impact of their healthcare, and that would include preventive strategies like screening, for example, to allow them to make a truly informed decision about what treatments or preventive strategies they want to undertake. But we also know that personalised approaches to prevention and healthcare in general have an environmental footprint themselves. So particularly things like AI and big data storage has a big footprint in terms of energy use and water usage. We have a lot of consumables used in things like genomics. And the research we do also has a significant impact. For example, cold storage in -80 freezers has a big energy use, and clinical trials have a huge carbon footprint. And if global clinical trials were a country, it would be the 7th biggest emitter in the world. So massive impact. And then we also need to think about some of the ethical challenges. So there are global inequities in terms of access to these personalised technologies versus the impact. So the carbon emissions are more dramatically affecting low middle income countries who can't access these technologies. And questions about whose responsibility is it to take on board reducing this environmental impact. So I'll just talk a little bit about some of the findings that we did from focus groups with the general public in the UK. So this was work done with Dr. Gabby Samuel, who's based at King's College London, and Miranda McFarlane, who's also based there. And we undertook 12 focus groups across the UK with members of the public, trying to understand what their values and beliefs and experiences were relating to the health system and its environmental impact. This is my very compact method slide, which I will brush over, but the sort of demographics of the focus groups are across the top. So more female, which is fairly standard in qualitative research. The majority of our groups were in England, but we also had groups across the UK. Most participants were professional, but we did have a good representation from working class and intermediate groups. And we had reasonably diverse ethnic mix, but majority white. And we followed a schedule in which we asked people to talk through a healthcare experience and think about its environmental impact. And we spoke a bit about broader global issues, and then used a series of newspaper prompts to think about some of these challenges in more detail. And we've analysed that using thematic analysis in a collaborative way, which more details will be in forthcoming papers. So just thinking about some of the key findings. So although generally our focus group participants were fairly engaged when you think about sustainability, actually most of them had never thought about sustainability in relation to healthcare. Key things that came out were that actually they really emphasised the need for holistic care that focused on their own individual needs, and they equated that to more sustainable care. And particularly they spoke about prevention and early diagnosis as being key to this, because that would mean that they wouldn't need to access healthcare and to use sort of NHS resources. As per this quote, if they spent a little more time and did a bit more, you'd save a lot of time and resources because you'd find the problem. We spoke a bit about talking about the environment within healthcare provider consultations. And generally, actually, participants didn't want to be asked to consider that in our focus groups themselves, which runs counter to some evidence that's coming out of the US and Germany in focus groups that have been done there. And there were a lot of reasons for that, but what came across a lot, thinking about the socio-political context in the UK, was dissatisfaction with the NHS and access to care, including access to good prevention. And that's reflected in other national surveys. So the Health Foundation have done some work in terms of questionnaires with members of the public, which has found that actually support for sustainability has been reducing over time. And people prioritised their own care and the care of their loved ones over the environment, this idea of relational proximity and how you prioritise care. People didn't considered healthcare and their own health to be quite a protected space, and noted that actually we need systemic change rather than individual choices to make a big impact on sustainability. And that was partly because being environmentally sustainable was sort of heavily moralized. So it was, people had this idea that to be sustainable was a morally good thing to do. But in the context of thinking about their own health, they weren't able to prioritize that, which resulted in feelings of guilt and shame, which they didn't feel was appropriate in a healthcare setting, as per this quote here. Thinking a little bit about some of the technologies that we might use in personalised prevention, participants spoke quite a lot about tech and data approaches to healthcare. This person saying, I'm hoping we'll all have monitors, and then your GP would get an alert if something was happening, and then they could prevent things and be more proactive about things. And they felt that they were already giving up so much personal data that actually that didn't really make a difference to them, and would be beneficial. And there was a degree of sort of techno-solutionism, so this idea that tech would improve healthcare and would improve sustainability. But people were aware, which surprised us, of the carbon footprint of things like AI and digital storage. And actually, I think that had some press coverage prior to the focus groups that we were running. So this person here is very aware of the significant energy use. This is talking about AI, so at the moment it requires the energy use equivalent to Sweden, but still thinks in healthcare AI could potentially be brilliant. But there was a lot of debate around that, and a lot of feeling of uncertainty, and this sense that actually that would potentially be taking away from the caring and the healing nature of the NHS as per the response below. Sort of concerns around implementing AI approaches. And also concerns around some of the socio-political context within which this is being implemented. So this person here is saying that although technology could be hugely beneficial when it's driven by profit and a sort of consumer-driven society, that will naturally create waste. And we heard a lot of reflections in the focus groups around sort of the way in which industrial approaches might really drive overconsumption and excessive waste. So to conclude, climate change is according to WHO, the biggest threat to health this century, and we need to undertake our research and clinical practice in personalised healthcare in a sustainable way. And I think personalised medicine and prevention has the potential to contribute to better and more environmentally sustainable and holistic patient care, but we need to be implementing this thinking about some of the many challenges. Thank you.